Well, the eye is the thing that we're all born with.
To see is to be able to have access.
We are judged by the level of detail that we are able to see.
The eye and the hand are the most important organs for a surgeon.
If I can't see, then I can't do my job to its highest level.
To see or not to see, that is the question.
I think of the head-mounted microscope as a second pair of eyes, if you will.
There's a question. What does high technology to you? Gives more trouble or makes life easier for you? That high technology makes life better for me.
What is truth? If you want to see something, you have to know what it is. And this is exactly what the microscope does. It shows you what exists.
It enhances your possibility, it enhances your power of surgical skills.
If you couple the possibility of magnification to a freedom of movement, I think that you really understand the possibilities of this instrument.
The field of view is crisp, clear. You see things that you have never seen before.
Your eyes are amazing, but the head-mounted microscope magnifies that multiple times. It magnifies, it autofocuses, it acts just like your eyes will act. Where you turn your head or your eyes, the head-mounted microscope follows you. I think most dentists would find the same way that I did, that they would feel like, wow, I've been missing a lot in the past, and now I can see what I'm doing.
In the past, a magnification of 2.5 or 3.5 was sufficient. Nowadays, however, we have to go to smaller structures. We nowadays operate on very small babies, premature babies. The smallest we have operated here had only a weight of 900 grams. And of course then you have to deal with very small structures.
A well-experienced surgeon is above 40 years old. That means he can never have a good eye. The best thing is as magnified as possible. The classical magnifying specs magnify only 4.5%. The one which I'm using magnifies for 9 times. So I can say I start when a normal surgeon stops.
Head-mounted microscopy is like an extension of the natural, highly developed human eye. For me, it's like a turbocharger for your engine. For instance, in the field of urology, you use magnification in very different kind of operations. One like vasovasostomy or varicose seals, very superficial, very nice access. On the other hand, you need it for nerve-sparing radical prostatectomies, which is deep down in the narrow pelvis. So with head-mounted microscopy, you are flexible to do all of these procedures with the same microscope.
The difference with the loops is that I can move from dissection to really microsurgical procedures very easily, and so it gave me freedom of movement and really a possibility to change the magnification during the operation in respect to the normal loops.
We have different distances all the time, yes? First you are on the abdomen, and then you are 20 centimeters deep in the deepness, yes? And so you need different distances, and you cannot change the loops. That's impossible. It's only possible to work with the head-mounted microscope. It's only possible.
I think the built-in camera is extremely important because the team can also see exactly what it is that I'm seeing and what I'm concentrating on doing. And in so doing, they are much more involved in the procedure than they're just looking at the back of my head while I'm looking down a deep, dark hole inside the patient. And it's very, very important in surgery that every member of the team feels ownership in the procedure, because that's the way to get everybody to produce their best and ultimately to deliver the best outcomes for the patient.
The lighting is actually so easy to use that I almost forgot about it because it's second nature with this machine. I don't think you could be any tighter than the inside of the canal of a tooth, and I have had zero issues with getting light down in those areas. I don't reach up for the light anymore and move around and try and do things. It's all right there, which is, like I said, I almost forgot about it because it's it's problem solved. Let's put it that way.
I normally operate about 6 to 7 hours in total with the head-mounted microscope a day, and I don't really feel it anymore. I'm so used to it. It's comfortable, it's well balanced, and once you really have adapted it, then it really is an enormous help, and it's luxury. I think it takes about 10-15 operations to really be adapted to this instrument. I always advise my young colleagues, if they start with the instrument, they should take about half an hour a day reading the newspapers, just to get used to that.
The most important thing about the learning process is that you have to breathe out before you start working, that you sink into another world. You're not guided by the tactility of your fingers, but you're guided by your eyes. And it's a very, very big difference. It's freedom of your spirit, because you go into a deep, very deep level of your consciousness that makes your hands stop trembling. And you're very calm at that moment. Yeah?